pray as we start. Father, we thank you for yet another time we come together just to have this serious conversation. God, thank you for MHstars. Thank you for the leadership under Reverend Wamboy. Thank you for all the board members, Lord. Thank you, Father, for all of us. Thank you because who you are. We are serving you, Lord. We're lifting up your name. And it's in Jesus' name I pray and believe. Amen and amen. I'm going to give it for Reverend Wamboy for disclaimer, and then Kevin will take over from here.
Okay. Good evening, good afternoon, good morning in Hawaii, or wherever you are in this world. Greetings, and we want to welcome you to this session where we will continue our conversations about mental health for individuals, families, communities of faith, community at large, and our nations, because we know we have families from other nations. So welcome, please relax. We will start the way we stopped last night. So we want you to relax because you're going to set the attitude on the platform for the others that are coming after us. So this time, we are just going to breathe in with our noses, breathe out with our mouth for 3. Count 3. I know we could do more, but 3 is good. If you are ever angry, you need to do this like 20 seconds, like 1, all the way to 20, or count backward until you settle well. We all get angry. It's a human emotion, but tonight it's not about anger. It's about prevention. Prevention is the best cure, and it is so good because what we can predict, we can actually prevent. We are empowered in so many areas, and we have gifted men and women. So please know that help and treatment are available in our own good old United States of America. That's where we are. And in other parts of the world, we're just speaking from where we are. So thank you so much. I'm going to share the disclaimer with you. Can we do this now? Ready? Are you ready? You can shake your body. If we are in person, you'll be dancing the twist and all other things. Like Come Now is likes to say, Jesus, Jesus, Jesus. But now we can say, mental health stars. We are stars by the grace of God. So breathe in with your nose and hold and go. You can even hear yourself. Breathe in again. Hold. Can you see when I'm breathing, I'm rising up as we are raising awareness? Breathe in. Breathe out. Last time I demonstrated how to run the Kalenjin marathon. Have you noticed? They all run with their mouths open, like taking air, and you keep on running, and you never run out of strength. And when they finish, I cannot believe they'll still be running, and they don't even stop. They don't collapse. But if you hold your breath, then at the end of the race, we may have to pick you up. But here we are available. Let me read the disclaimer, the short version. We have it on the screen. We are so grateful. We are honored. This is a gift from God. We have Brother Kevin. He has put it in writing, and we share it together. I'm going to read the short version and encourage you also, as I read the short version, that you can see that there is a shorter version. Are we ready?
Yes.
You've been ready. Here is our disclaimer, and we appreciate our audience on YouTube in the future days, and we are so grateful. We are honored. We are privileged. We value you. We respect you. We need to use these words: value, honor, and respect. Sometimes people tell you, I love you, Reverend Waboy. I like what you do. How about your presence? It communicates value, it communicates honor, it communicates respect. RESPCT. Now, here is a shorter version. Read the longer one. Suggestions made here are never a diagnostic impression, a substitute for treatment, or follow-up activities that are required and consented by your doctor. You get into a consent with your doctor or your psychiatrist or your therapist, even your primary care physician who makes sometimes referrals to a psychiatric hospital. That is our disclaimer. Please know that we appreciate you, but we need to talk about our speakers and presenters and moderators have volunteered to share important information to help us raise awareness of mental health issues in the diaspora, USA community, and community at large. And we also aim to reach a community of faith in our churches. And those are very good, safe spaces for us to communicate and talk about these issues. The platform is inclusive and it's actually open to all people. It's open to the public. Here we go now. We are going to start with our presentation. And we may have to start with Kevin. That's what I see. And I wanted to give a simple but yet understandable overview of what is depression. Depression is an affective disorder that impacts physical, mental, and emotional health. It often interferes with everyday life, causing suffering for both those with the disorder and those who care about them, like your family. However, unlike normal experiences of loss or sadness or distress or tests or trials and tribulations for us who are believers, depression is characterized by intense, enduring feelings of hopelessness and helplessness. So people with depression may feel so disappointed in themselves and their lives that sometimes they lose the will to live. And for us, that's why we talk about depression. One concern that we have, and many people express this concern, is genetic causes. People are like, well, I had a grandfather or mother who was depressed. Am I going to be a depressed person? But the answer is some people, some, S-O-M-E is very important, not everyone. Some people may have a predisposition for affective disorders or depression. People with family histories of depression have an increased risk of developing it. Heredity does not automatically mean that a person will be affected by this disorder, because sometimes we can accommodate, change our behavior, change our environment. I know yesterday I talked about moving, and it was serious. That can someone avoid depression by going home to Kenya, Uganda, Tanzania, Africa, Latin America? And the answer is sometimes yes, but please do so with consultation with your physician. That's all the overview I need to talk about this afternoon, because we have Mr. Kevin Goge, who is our nursing practitioner and now is acting as our Fundi wa Mitabo, Fundi wa Mitabo, and he is a licensed nursing practitioner. What we mean by that, it is like just one step away from the doctor. Myself, as an individual, I prefer when I go to the hospital to speak with a nursing practitioner or physician assistant because it takes a little bit more than 5 minutes to listen. The doctor is in a hurry. So one time, the doctor wrote in the notes, this woman is a Caucasian woman, meaning white. Excuse me, if you know my family, we are as dark as we can be. So I was like, this must not mean this person, this person the doctor has just seen is really not a Caucasian. This was Ali, an African woman who is black like me. And I went back there and say, you made a mistake. And the doctor was so sure he did not make a mistake. Doctors don't make mistakes. They have God complex sometimes. No offense. No offense intended. I'm just saying that we are grateful to have doctors, nurses, mental health providers, caretakers, family. And as I was speaking, we want to welcome those who have joined us. Zoom user, Muzalendo. We need to adopt Muzalendo. He's going to be a member of mental health. Next time, he's going to have 1 whole hour. He's so resourceful. And we want to say thank you for Smith. And we are ready to go with Kevin.
Hello, good afternoon. Can you hear me clear? Can you hear me?
You're good.
All right, great. Thank you. Awesome. Exciting opportunity to again come back and break them loose and deal with them here and address them. So have a seat, take a pen and paper, and let's equip ourselves. We look at this like a workshop. You come and you learn. We give you tools so when you get back out at home or in your community, it could be at work, in your house, at church, or it could be even in just a bus stop on your regular day-to-day life. We give you tools so you can be able to tell, hey, when you see something, you say something. Let's save one person's life, a man, a daughter, a husband, a brother, a sister. And when we lose one person in our community, that's life lost. That's a generation, if you look at it. And it's too much to lose. What can we do? How can we get ahead of it? How can we equip ourselves to better serve our people? And we want to get off that stigma. And I was talking to a friend, and what we address here are things that, back from a cultural perspective, we tend to shy away from facing the reality of mental health issues. Like Reverend Wamboy was talking about, depression is one of them, but it leads to other things, alcoholism, or we're seeing now people to where they can't handle it no more, and they taking their own lives or take a family life or can't handle their stress. Is this stress necessary? I think it's necessary for life, but we need to be able to manage it. And that way we are better citizens, better productive. We get to the goals that we have for our life. And with these forums, we're here to equip our communities, our listeners. When you come, we want to engage with you and we want to learn from you and also share what we have. We have been doing this for a year, many years, 7 years. But during the year, we come to you every month with different sessions and different presenters. And then you get once a year, which you get an annual conference. And this is what we have. We pick like a Friday, Saturday, we share what we have and we invite different presenters. And I'm super excited to be part of the team. And we bring you a different perspective. All we're looking and we're passionate about is the unity of a family, the unity of a family. And for us, we want to give you tools and we want to be able to sharpen and just share what we have. Some of us from what we see every day at work or in our practice, and we'll bring it so we can give you more tools so that family or their home stands due to the different items that we share. So I'll share a couple slides here. They'll be telling a story how being doing this for some time, and you'll see a couple flyers going by and just different occasions that we've been able to gather together. And we encourage you, if you want to call, if you have a friend, you have a sister, hey, jump on in, come and listen. Why? Because we bring different presenters that see things differently, and they tell different stories. Could be from money. Sometimes we had this morning for children and things, and specialists that see children, and we see how can they equip us, how can they share, and we have a very broad selection. And the biggest thing and the foundation is majority of them have our culture as the background. What does that mean? They understand where we come from. They understand our struggles. They know our culture. They know what we fear. And at the end of it, they are very, very encouraging that they end up sharing their own resources in terms of their contacts. And with their contact, we encourage you when you call after these sessions, hey, let them know, hey, I connected you from MHstars uh, annual conference, and I would like to, follow through, give them your concern and what you need. We really emphasize you respect their practice, because they go by what's requirement in terms of the laws that govern their practices and their guidelines. So be respectful. Even if it's your fellow Kenyan, don't overstep. Follow their process. If they require you to register for a session, if they invite you for a follow up, we highly recommend follow their practices. Just because we meet here, we don't bypass their practicing or there are laws that they have to govern. Some are in different states. Some have to get you referred to someone closer to your um, particular zip code or city. So we are here to just make that connection. Our ask is, as you learn this information and you become empowered, go practice it. Teach somebody, share it in your home, employ, get it to deploy so you can get the results. You get from here, you learn, but you got to put it into practice. I'm a big fan of men's health, and I'll be touching on that a little bit this afternoon. But as you look here, and as we are sharing at the end of the sessions, we'll have like a different contact, so we can be able to share and provide you like a follow up. If you pick up their call, if you send them an email, whatever they recommend, even to connect with you if it's a session scheduled, follow up. If you have a provider that you see and you come into this session and you still have to follow up with them. We are not here to substitute nothing that you currently have in plan with your current provider. We highly recommend it. Keep up with it. If you need a pastoral help, the servant one boy, but hey, follow through. Awesome. With that said, I want to touch on a few things, and it's about our community and men. Our community and men. We see different things come up for them, and I'll touch on a few items that help us to kind of be a little bit more inclined and how can we support men in our communities. And let me see if I can share my slide here. Just a second. Can y'all see my screen? No? Yes? Oh.
We can't see your screen.
Did I lose her? Can y'all hear me?
You need to you need to share everything. Share. Sound, computer, everything.
Okay.
Share sound, optimize video sharing,
Okay.
all that. Thank you.
All right. Let me bring it over real quick here. Okay. Once you hear me, but you can't see it, right?
We hear you very clearly.
All right. Let me. Okay. All right. So I'll go over a couple of items here um, that I had
Before I
a
could see
couple
it,
bullets for.
before we could see it,
Sure.
now we don't see. Before you are explaining the flyer, we could see it.
Okay. All right. So just hang on tight. Let me see if you'll come through. So I'll talk about our men in our communities and some of the things that we can support. And this is young men, including like high schoolers, all the way up to our senior citizens. Um, but we are seeing an uptrend in terms of, and this is not in a good way. One, they're not coming into the hospital on time in terms of just seeking even an annual physical. That's one. Secondly, we are seeing very, very young men in our communities that are taking their lives, not able to handle the stress that comes with life and the adjustments that come with just being independent. And also sometimes we are seeing also in college it's becoming too much. And you have another group of young men that already in careers, they're doing well, but there's that piece that's missing in terms of a plug to balance your life. And we'll be looking at a couple solutions. How can we get our men who are in these different age groups or in these different age buckets to have that smooth transition or even just a balanced life, to cut down especially the rate in which that we are seeing suicide and also depression rates in our community. And then you have the other downside that majority of, not all men, but we are seeing an uptick in substance abuse among our diaspora communities. So I'll touch on a few things. It might be an overlap of a few items that were discussed this morning, but I just want to share something here. For our young men, these are just like teenagers going into young adult. So there are some studies done, and this is what it came up to. Children who feel close to their fathers, 80% are less likely to end up in jail. And you imagine that 80%. So just having a dad connect with the child, you cut down the rate of them going into jail. If you take away that, uh, the rate of going to jail goes astronomically high. Listen to this piece also. 75% of adolescent young men that do substance abuse are from fatherless homes. 75% of young men that do substance abuse are from fatherless homes. So, with that aside, let's come down to what can we do to try to fix that. And if you look at this, how can we prevent this? Now, I'll give you these numbers. In some of this, you can look them up. And it's not to create the fear, it's just to give you an awareness. So, this is a problem not only in our community, we're looking at abroad, for example, in North America, where majority of us are. How can we cut this down? And this is where we come in. We don't want none of us to end up in this and our family or friends to be part of that data. And your screening is what we cry for. And be honest, man, when you go to do this, please take your time. Fill up the information in front of you provided. Some of the screening, you have to be honest. You might need to just go and just, for example, if you have a younger, like a teenager, let them complete that assessment by themselves. As a parent, sometimes you go with them and you're trying to fill in because our culture, hey, wacha nikufanyie, let me do it for you. No, let them just go through the question and answer. So if something can be depicted, can be answered, can be addressed, can be referred, can be treated, or it could be just as simple as a therapy session. Now, learning new styles to manage life and work-life balance. You had this morning from our presenters, work-life balance. We work, but we have to have time to rest and also self-care. Self-care is really, really big, especially in this time of age. It could be just a simple walk to the park. It could be exercise at the gym. And these are just ways that men, we need to take care of ourselves. As a community, we need to advocate for our men to do better. If you're at home with your wife and you see your husband and they're working, hey, try to work and add some form of shape of his time in there. Could be cut off work a little bit or get off a little earlier, go to the gym before you come home, or leave a little earlier, go to the gym before you get to work. Work life balance, just time with your kids. Men, we need to be, I know we provide this and we are go getters for this, but your presence in the house, your voice, your listening ear, your advice, that's what cuts down on that rate of kids going to jail. That what counts to prevent them to, when they listen, when you listen to our kids, it helps them to navigate through life. When you give them their comment, their feedback, you mold them. And this is where, when they're young, as they get into teenager years, when they hear your voice, and I'm a big advocate, let your voice be the loudest they hear or they remember when they're in that tough point. What you encouraged them with, what you gave them feedback about, what you motivated them, how you recommend them, how you get them out of the door in the morning, their final word. Let that be what they remember. And it could be even just reading the word of God. Those are the key things that they take on in life that you can replace with material stuff, but you equip them. Should they be hired for work and they have to get positive criticism, they don't shy away, they don't get broken, they don't see themselves as failures. All right, let's go back to remember, what can we do for our men in our community? And this is part of the solution. Is this everything? No. But these are small nuggets that over time will help to mold them, will help to prepare them, will help to keep our men stronger, will help, especially with work life balance. They live longer. All right, community support. Check on our men, ask how they're feeling. And this is just, I'm feeling good, and keep going. Man, we need to have a, some form of shape that you can get disconnect from your routine and just have, it could be a community of 3 or 4 men that sit down together, and it's a true conversation. You know how you're feeling, how's your marriage, how's your family, and there's honest feedback and exchange and building each other. Those help our men a lot. We don't have, like we used to, think back home, you get off work, you stop at Kawama, you eat and talk with your friends and buddies, and then you go back home. And there used to be mwaki wadu, this kind of stuff, where men will meet and talk and share ideas, be sharpened, and you know, get, it could be simple stuff, business deal, or just hey, I'm dealing with this in the office. See you in the same. How can you give me advice on? So this kind of community support helps, and you have to create time for it. But these are just some simple things that I believe we can start early to help prevent. And when our kids see this, they emulate. They sometimes you bring them, they listen, and they form the same thing. But it's a stronger man down the line. Awareness, family history. It's really, really important to know this, especially for things like depression. Is this something in your family that you have chemical imbalance, and it's upon you to stop and cut off their cycle, so it doesn't go down to your children or even your children's children? Understanding your history, if you have any genetic diseases that tend to link in your family, if hypertension is one of them, get ahead of it. Don't get a stroke over something that you can control and prevent. We see men come too late, and I'll say that we see men seek help too late. And the women, they are, the intuition, they don't feel good, and they'll talk about it, but they'll go somewhere for it. Men will mask it off. They won't go after it. They'll, oh, I can push one more day, and I'll take care of it next week, next week, next, and the year is gone. So please, for that awareness of how your family is, your history, is really good. The other thing about being aware of yourself, how much can you handle? What's your capacity? What ticks you off? Those kind of things. And being, it's okay to walk away from things. I think we are at a point in our culture where we more and more, and it's okay to have a no and to give it a positive no. And it's okay to walk away from things, especially at work. Sometimes it's too much, and you got to be aware, hey, when they push me to this limit, either I drink more, or I black out, or I can't drive, or start shaking. That awareness of yourself creates a boundary, and you cut it off. You have guardrails for yourself. So you prevent yourself from either doing something so adverse or things you regret. We have seen people come home and their stress is too much, and they snap because they didn't cut their rails, and they taking families out. over something that could have been talked about, or they could have get in the car or get out and just walk and get a different idea of perspective. And it's also good when your family knows around, hey, don't push that to that limit, don't push uncle to that limit, and they're respectful. So when, even if it's a heated conversation, because they do come on, we have guardrails that keep us safe. All right. Seeking mentorship. These are also opportunities that we can offer to our young men in our community, and this helps a lot so that they can have guidance as they evolve and grow into corporate levels or even corporate positions. And how do you handle? How do you manage? Some of us, you we didn't have positions that will make you travel everywhere, and you have someone that's been doing it for 10, 15 years. Hey, how do you manage your life and traveling everywhere at the same time? So mentorship helps, and it helps not only to self-reflect, but also to help create that anticipation in your goals as a man. And it could be mentorship on your marriage, it could be mentorship in your career, it could be mentorship in your own personal life, or mentorship, get a coach that helps you along this journey. And we need to be open to those, because when you share this and when we create these avenues for younger men, even if they get into those tough times, they know how to navigate. When they get into those really challenging moments, they won't buckle, they won't give up, they won't quit, they won't run to substance abuse. But remember, it's what they've been hearing and what they've been exposed to. I think mentoring also helps to understand, hey, you will fail in life. Because sometimes, as much as we want success for our kids, share your pitfalls, share your failures, so they, as they go along the way, when they fail, because they will, as they fail, they know how to get back up, they know who to call for it, they know how to not avoid it, but hey, I failed at this, what did I learn, how can I do it different so I don't end up here? So mentorship is something, and this can be provided in our community. It's really good, especially when you have someone that comes from your culture, same background, might not be that close, but they kind of help because you understand the tradition, you understand your dynamics. It could be a family burden. How do you balance life here and in Kenya? Hey, they need us to construct, or I need to do projects here, I need to do projects in Kenya. How do you balance that? And mentorship is one thing that I believe as a community, because we have so many successful Kenyans, that our kids should not be failing and falling off and giving up with the amount of success that we have. All right. Encouragement to seek credible professional help. Coaches are really, really very supportive, and they're there for the different platforms or avenues or even careers that we have. And just have a safe place that you can voice. We should not be judging our men, our communities. We should be building them up. When they fail, when it didn't work out, just if they come home, even if it's a child, they switch to majors or something, let us have that open conversation, hear them, and help them navigate. Don't shut them down, don't criticize them to the point where they're giving up and quitting. I think it's really recommended that as a community, we embrace them, but provide them guidance even in that time, not to lift their hands, not to quit, not to push them off, but to embrace them, show them love, and help them rise from their failure. With that said, back to you, come now. I'm super, super excited. Our men, please, as you close out the year, get your annual. Back to you. Bye bye.
Thank you, sir. Thank you very, very much. A good topic about men. We need to go to our annual. Anyone with a question before I hand it over to Rev to introduce the next speaker, or a comment? So I have a question for you. What does it make a difference between um, the slowness that we have and our ladies? Why are we slow to take that action of seeing the doctors? Because our ladies are always ready, daughters are always ready to go for checkup, but we take time. What is that thing that makes us so scared?
I think it comes from a and this is not the final call, but we see a lot of cultural, it's like a norm or a taboo that we were brought up with this mindset that, hey, if you go to the doctor, you're sick. You don't go to the doctor unless you're sick. Secondly, our parents, they didn't see it where they would just go for a checkup. This is something that they shied away from even annual checkup, and they only had the mentality. The mentality here is the biggest thing. Our culture did not do a lot of front leg in terms of us seeking just annual checkups. We only have the mentality you only go to the doctor when it's broken or you're sick, and we have to get that off. But you see, women tend to, especially because of having that session where they some of them go through pregnancy, or that makes them have their doctor relationship early, and they build on that. So by the time they are 100% on their own, or it's after birth, those extra appointments make them build their relationship, and the fear is gone away. But for men, we still have a lot of work to do. And then there's the trust, just being able to sit with this individual. It could be a practitioner or a doctor, and you have to disclose that. And speaking things that some people consider so personal, we see a lot of hesitance there in men, but we have to really change our mindset around that.
All right, cool.
Your
Go ahead,
question.
Rev. Thank you.
My comment is from birth till when you graduate from high school, our young men are in contact with the physicians because in the school system, until it changes in the USA, our public school system requires every young man, every child, every student from pre-K all the way to high school graduation to have an annual physical. Then if you have other issues, and I'm going to let the doctor talk more because mine is only to check the records. I'm good with record keeping to make sure any student who was on my caseload had a physical, a current physical, let's say by August 1 of every year, the first semester of fall. If a child is taking medication like ADHD or oppositional disorder or any, because we think that in the school system, children are only treated for behavior. But remember, even diabetes, juvenile diabetes, that child comes to school. And that's why our public schools have professionals like a nurse who has a master's degree and is licensed. And we have a behavioral health person like me. All the counselors in school are actually, no one has less than bachelor's degree. It's higher education because we are aware of these dynamics that sickness does not always manifest when you're an adult. I said in the previous session that when you're a child, you are building the house that you are building the house that you will occupy as an adult. I mean, as a child, you are building the home or the environment that you will occupy as an adult. So we do have diseases and illnesses that are set up in childhood. Actually, for the most part, diseases like schizophrenia, which is hard to treat mental illness, starts to manifest during sometimes adolescence and even later, where your body is going through these major developmental changes that either your body, your mind, and your soul cannot handle it. But thank God that there is help. Also, as I said, we have speech pathologists or speech therapists in school, occupational therapists. And one thing that we did not mention earlier when we talked about children, if you're concerned about your child, guess what? You can ask your school psychologist, all our public schools in the state of Georgia, for example, and I have lived in 2 other states, which I'm not going to mention, they have a school psychologist. Please ask as a parent. You are empowered to ask the school psychologist, to do an assessment on your child. By the way, the same psychologists are the ones who are able to identify that we have talented and gifted students in the school system, children actually, even from 3-year-old, a 3-year-old all the way to graduation to college. And if a child is developmentally challenged, we will allow you in our school system to study at home, or um, or allow you in our school system to continue until you're 21 years old, so that you can put measures for this adult not to have such an extreme difficult situation in school. So we have all the help. Remember, you are not being charged. For younger men, after you are graduated from high school, my question to Mr. Kevin is, some of our young men and women, mostly young men, they do not have health insurance. Can you please help us? How can we access help when we don't even have health insurance? Where are we going to get help from? Even though I know I need help, where is it going to come from?
Thank you. Great question, Reverend Omboy. So, this, for example, and I'll speak for Atlanta a little bit. I've been here for some time, but it's really, really good that you plug in with your local health. It's called community health office. So when you go there, majority, if you go, for example, let me share my screen real quick just to kind of show everybody this uh, what it looks like. Local community health, and you can welcome to take a look at this zip code. It's called findhelp.org. Findhelp.org. So if you come here and let's say you type your zip code, uh, it'll give you. Just give it. Can y'all see my screen? So this is just a quick way, and we encourage our presenters that are coming in. If you have an organization and you have a clinic or you provide services, it's really good to be registered with this link here so you can be added into the particular area that you cover. And this is more resources and more support to our communities at your local zip code. And this is one way that you can look for help. If you use this and you just type in your zip code, come on, let's do it. It gives you your local health office, or you can choose. And there are a couple, like Good Samaritan is another company. There might not be in every single zip code, but it's also a really, really good resource that you can use. So like you saw there, I just typed my zip code and it gives you this, and you can click here. If you click, you see medical care, it gives you all this different facilities that you can use. Now, if you need just a general doctor, I would recommend using the Department of Health. The Department of Health, the cost is super low, and you get scheduled, and you'll be able to see they have a nurse. Majority have staffed with nurse practitioners and a medical doctor that oversees them, but it's one place that's supported by your local government, and you can go. They treat from major diseases, communicable diseases. They also give you discounted treatment. They can also give you local referrals. So it's one place that you can use to just get a local support. Because, for example, if you're in Arizona and you use this, it goes way into where you are. Now, this is Atlanta. I just used it. I'll click on it. Let's see. And you can see the different support system that they have. Let me see if we can have, you see primary care here. And I'm just giving us example. So if you use findhelp.org and you just type it there and give it a moment. So you see all these are primary care doctors that are listed here for their particular zip code. You have different doctors, and This, I'll speak about this. This clinic here, they have a dentist, they have a primary care doctor, and they charge very low fee on none. The first Saturday of every month, they provide dental care for free. That means even if you have a toothache, they'll take, they'll either fill it or take it out. And this just local things that you'll find. You can own, if you're in Atlanta and you would like to use this, I've seen people even come here to get dental work and you line up. People start even at 7, but it's so subsidized or none, no cost at all. So these are just local things that people can use. And some of them, like this one, also provides medication. So if you need to be on like a refill or need, for example, I'll use hypertension, you take medication for it and you need on a consistent regimen, they can put you on that. So I'll recommend also our presenters, if you have, please be listed on this. So as our diaspora community is trying to identify where they can get help, when they search here, they can find you and connect with you from your local city or community. I hope I answered your question, Reverend One Boy. But this is really, really, really helpful.
Perfect. Encourage parents to partner with your schools. You can't get away if you trust the system with your child for more than 40 hours a week. And if they pick your child from school, this is where Kevin, you can say that I'm the repeating officer for all the schools, public schools and private schools in the United States of America. I have been blessed to work in all for, I would say, 25 years experience. And most of my time was on behavior issues. Please trust your school. Actually, many times, the teachers, the staff, they probably know your child more. I know that we are curtailing some of the privileges that we ask the parents to give us consent. We have even been able to transport students to the clinic, to the health clinic, to get the services they help without taking much time. Have you noticed in your zip code? Why is the health department close to your schools? Why is the juvenile probation place closer to your school? Less than 4 miles, less than 2 miles. For mine, it's like 2 miles. All the schools I worked, they were very close to government services, including Department of Children and Family Services. It is by design so that if we are going to work with a child to increase attendance, behavior, and grades, we are going to make sure if you give us consent, we will access all the services between 9 a.m. and 3 p.m. of every day. And that's why I can speak for the schools, and we were wonderful record keepers. We know where your child is every 5 minutes, and we give them a card if they are going to the restroom and they don't go alone. Remember, in our hallways, in the schools, there is surveillance. We don't lose children. They only get lost between home and school, but very rare in the public school system in the United States of America can a child not be known where they were 10 minutes ago. Number 3, is it number 2? The principal has a surveillance from his office. Principals used to walk in the hallway. Now he just sits in the office and he can survey the entire compound of the school, okay? Sitting on his computer. Now, finally, brethren, Reverend Waboy as a behavior counselor, once I take out a student from a school, from the classroom, we know where the student is all the time. Number 4, I was a school bus driver myself. Once I turned the key, I'm the first hustler in diaspora. When I turned the key of that bus to start it, it has a surveillance. There is nothing that we cannot figure out. Where is this child? Do you know where the problem is? My problem was when a parent says, call the office. I have not seen my child. And the question is, where is your child? What were they doing? When were they doing it? With who? Who, where, what, when, and how did the child come to school? Because we check the record. As a bus driver, on my log, I have the list of everyone who boards my bus. Do you know what I do? Check, 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 check. I even check the bus. I even crawl under the bus to just make sure it's okay. So we are not going to lose any child. And I want to encourage, I put a comment here that says, because I can get very excited. The counselors, like we have a comment here, they have so many students. They don't know what to do. How about referring the students to a responsible place? Get a consent from the parent. I have been known that parents sometimes sign. Be very careful. That consent is valid for 1 year. So you, on the other side, we are not saying we are going to give the school permission to do everything they think about your child without your knowledge, except this one, I'm sure. If your child is arrested, it always broke my heart. I have been there personally because of behavior. When your child is arrested by the school resource officers, they are real police that are in our school system. If a child is arrested, what broke my heart to this very day, if I can live again, if I talk about it, I'll cry. The last person to be notified that your baby girl and your baby boy has been arrested. Even in Kenya, we used to have such schools because of behavior. Your child becomes a ward of the juvenile people, professionals, and that breaks my heart. I used to beg, please let us call the parent. You know what they say? He can call us at the station. That means your child has already been placed in a cell of some kind. And by the way, our doctor is in the house. He has arrived. I'm going to cut this short because I can talk forever about children without reading anything, because the reason I was ordained as a minister within the school public system is because I was allowed to go and see my students. My student is middle school. This is a 12-year-old child. This is a 13-year-old boy, especially Black boys. They know me. So if they hear me talking, they understand. I wrote and wrote articles until I couldn't write anymore. I almost got disciplined. I almost could have been jailed with my students because I used to see them in jail. And the only thing I could use in that jail is a Bible. So our boy got smart. I'm an evangelist who preaches outdoors. I don't need a platform, but if you give it to me, I will. It's very expensive. That's why many pastors might not invite me. But I'm going to tell you this. I do have permission to this very day to go and visit men and women now in jail, especially at this time, even ICE jails, anybody whose family was referred for deportation here where I am, I made contact with them. But sometimes because we are from the same culture, they said, oh, a boy cannot be the one here in this jail. So I would go in as Tata. So everybody needs to know who is Tata. And I see this person, I have never seen them before. I say, I'm your auntie Wamboy. And they're like, oh, you are my auntie. I say, I'm the only person, I'm the only auntie, I'm the only brother or sister who will actually see you in jail. And I have seen people in Pennsylvania, Washington, almost went to Arizona. Oh, very far away in Pennsylvania, some place called Louisburg, very far away. It took me many hours to go. San Antonio, some place called Parasol, which is 35 miles away from Mexico border. Here in Georgia, Atlanta, Alabama, I have even prayed for some prisons and jails that I can accurately tell you. The one next to my house, 30 miles from here, got close. I used to circle and pray because it was grieving my spirit, because that is a place for deportation. All this to say, I am in mental health, but in my heart of hearts, I pray that we understand and work together with the people who have given their children for 40 hours, and that is the parent. Parent, if you are listening, you are the most significant individual in the life of your child. Whether you are single or married, a child needs one person. When I say this, who is tight with you, that who can go the extra mile with you. If I did this for my high school students, and I say, hey, one boy in the school, I'm not reverend. One boy is tight with us, meaning I will hear, I will listen, I will validate, I will affirm, I will walk the next extra 5 miles. It doesn't matter. I have taken flights to California to see a young man in jail because I could and I can, and I'm allowed by the state, but I'm also, my permission is also heavenly. I have a call because I don't want anybody, boy or girl, especially during when they are young, to suffer. I want every young person to know their help is available. I charge parents. You say, I call you and I say, this was not my session, but the other person skipped. One time, the parent told me, I told the parent, so-and-so is having issues in school. Can you please come and we talk? And she said, my kid is okay. I don't know what is your problem in the school. You counselor? You're not going to tell me how to raise my child? And I said, yes, ma'am. I cannot tell you how to raise your child. But if you allow us, from Africa, we say, it takes a village to raise a child, because your child, you function in the village with significant adults between now when they are young and when they graduate from high school. You have recreation, you have home, communities of faith, communities at large, all the spaces where we spend time. Thank you very much. Oh my goodness, Dr. Gerald Mohari, and he is also, let me say, he is here with us. I'm just looking. I like the video. If you have the video, then I stop talking. I'm like a student. You put in the media, social media. We have Gerald P. Mohati, PhD, nurse practitioner, primary care nurse practitioner, and a doctorate of philosophy degree from Wilkes University in May 2022, and a Master of Science from the University of Maryland, Baltimore. Oh my gosh, he's so educated. In May 2009, where he trained as a nurse, family nursing practitioner. During his master's degree training, he also studied and obtained a postgraduate certificate that focused on teaching in nursing and health professions. In May 2009, Gerald earned a Bachelor of Science degree with a major in nursing from where? Oh, he has been somewhere else. With a major in nursing from Texas Women's University in Denton, Texas. Oh, I know that place. I've been there for a conference. Okay. Fast forward. I want you to know he does have his own practice. Thank you for volunteering and sharing your time with diaspora. As Kevin said earlier, we can Google what is wrong with us, almost become our own doctors. We can have ChatGPT do diagnostic impression. I love AI. I think I need to study artificial intelligence. But AI tells me that he or she has mistakes. But we are not looking for AI and GPT and Google. Don't tell a Kenyan Google that. That's not right. Point them to our doctor. We need a person with, simply said, flesh and blood. Like the doctor who was talking earlier, he kept saying wanaume. And most of you could understand Swahili, but not everybody. He was saying men. I was like, yes, yes, we need somebody who understands. But I want you to know we are going beyond Diaspora USA. Our doctor is a doctor for all people in the USA, inclusive, regardless of race, religion, or gender. As you see, where he studied and what he studied. And I have a rave for you, Dr. Gerald. I personally, as Wamboi, which I put here, I prefer to go to a family nursing practitioner because at least he takes more than 5 minutes to listen to me, because you all know you have not seen me. If you have ever met me, I always have a book and a pen. So the doctor is, doctor, today I am having 5 things. 1, 2, by the time I say 3, he is diagnosing me and calling me Caucasian. Am I a Caucasian woman? So he wrote, this is a Caucasian woman, this many years. I was like, wow, no. That's why, but no offense. No bad mouthing any doctor. We're just saying, I prefer someone who understands. Welcome so much, doctor. You have all the time that you need to present, and I know there's going to be questions. And our previous speaker was Kevin. He talked about health and following up with the doctors. But guess what? Now we can test. Thank you. Welcome.
Okay. Do you have my slides, or you want me to try to share it?
They are in. Okay, hold on. They are emailed, but we can give you screen share, multiple screen sharing, please.
Mm-hmm.
Just hold on. We gotta get it. We are going to call Kevin. In the meantime, let's appreciate individuals who have joined us. We have just gonna say Peter, Zoom, Smith, Kimaro, Jay, and another Zoom, KE. I am Reverend Wamboi Njoroge. I'm the one who was ordained to go and minister to young people in distress, but I have this great report that I can tell you all the students I worked with, that I never lost one. I will follow you to the end of the world. The fastest and the farthest I ever followed a student was in the island, Marshall Island. I do not lose, no child of that was placed in my care fell through the cracks, here, or wherever. No, because maybe also because I'm a mother. And why parents see the doctors most? Because we are also the ones who take our children to see the doctor. On a bad note, when you're older, when you're a senior like me, sometimes the same doctor we had with our child, he thinks I need attention. So it's hard to say, is my boy sick or she needs attention? Because we have been with this doctor for, let's say, 25 years. So he knows me. One time he saw me in the reception, and in the notes he said he had seen me. I was like, oh, I did not see him in the office. But anyway, he's in my community, and I have no, we're looking for the slides.
I got them on myself.
Okay.
I got them on. Can you hear?
Yeah, go ahead. You can start.
Hi, good evening, everyone. Thanks for everyone for taking the time to attend the meeting, and thanks, Reverend Wamboy, for inviting. And again, as I also introduced, my name is Jared Mahati. I do practice family medicine, and I also do some teaching.
We can hear you.
Okay, while we are waiting, we are going technical difficulties. We have a question. Many parents struggle to obtain mental health medication. They need a paper script each month. Many don't have transportation, and Medicaid makes them jump through the hoops on many of the prescriptions. I wish you were in our school system. By the way, I'm allowed to transport passengers, many 16, and myself, and I have a commercial driver license with liability, and I have to submit myself to drug testing. So if your school can hire me, I'll be transporting everybody safely. So I cannot even have a speeding ticket or anything. So please ask your school principal, make a parent teacher conference and find out. And if there are more parents in need, solicit the help of the school nurse. In some schools like mine, because of commissioning, joint commission, we are allowed to give medicine in the school system, and we have a way of keeping it safe. But it cannot be given by one person. There's always going to be two witnesses that are qualified and have signed a consent because of HIPAA. So it is not the teachers that give medication. It is the staff, like the office secretary, the behavior counselor, that would be me, a nurse, and any other professional allowed and consented in writing. So the parent does know who is giving this child medication, which means the school is in cahoots with your doctor also. I know parents, I don't want anybody to know. Well, within the limit of confidentiality, even although I'm not practicing in clinical sense, I give you my confidence at all times unless you disclose that someone is harming you or you are harming somebody. Okay, we are back. Can we hear that? Do we have the screen again?
Yeah, I have it. I got
Okay.
kicked out. Hold on. I'm going to put
All right.
it.
And we can see where you are. I think you need to be raised up a little so that we can see your portrait. And while we are adjusting, if you have a question, please go ahead. We have somebody. Oh, Lorraine Smith, please hang up. I mean, don't hang up, but hang out here with us because we will want you to say a few words. You are so resourceful. It is amazing. Yeah. Yes,
Okay, see me now?
Good. It's good.
Okay, so today's presentation, Reverend Wamboy, thanks for introducing me again and for the invite. A pleasure to be with you. And I'm just going to dive into the topic and then we can chat a little bit later after I'm done. So today I'm focusing on depression. While I'm going to talk about depression as a whole, I'm going to have a few inputs of how it affects men versus women and what we can do to help men and even other people and in general to live a better life with depression or without depression. And just for background, depression is one of the most common psychiatric disorder in the world actually. And in the United States, 13% prevalent in adolescents and adults, meaning from 12 years and old, 13% of the people have depression of some sort. More women are affected than men, 16 to 1 ratio percent, and more women seek help compared to men. So our biggest focus here is to allow you that as men, we suffer more depression without being treated because we don't seek help. And part of it is because we feel like we're man enough, don't need help, you can do everything. But that should not be the case. We also, at the bottom line, we're still human. And interestingly, over 87% of people affected depression have difficulty in life because of depression. So for instance, if you are depressed, you have 87% chances of having difficulty in life, difficulty adjusting to work, coping with the family, or even having social interactions. And if you have depression, there's also a higher risk from death because of other diseases. But why will that be the case? Most likely it is because when you are depressed, sometimes you don't do what you're supposed to do to take care of yourself. So if you get a disease that needs you to go to the doctor frequently and you are depressed, feel withdrawn, feel like you don't need to do anything, you don't need to be around, you will not take the charge to go to the doctor to get treatment, and thus that will lead you to have complication of the other medical problems you have. And the depression symptoms have been associated with an increase in cardiovascular disease incidence, as I mentioned, including death. Now, there's a key terms here that I wanted us to discuss. First of all, I define depression as a state of having depressed mood ranging from mild to severe depression that persists for over 2 weeks, and that's the established diagnosis description for depression. And PHQ-9, this is a depression screening tool. It's used in primary care, but also used in specialty, I'm sure. It's a health questionnaire whereby the doctor or the healthcare provider gives the patient to self-complete this questionnaire as a screening tool for depression. It has 9 items into it that the patient answers. I'll have it down next in my slide to see what it is. Psychotherapy, which refers to the use of psychological methods, usually based on a regular personal interaction to help the person change their behavior, increase happiness, and overcome problems. And this is one of the treatment therapies for depression and other mood disorders. Pharmacotherapeutics, referring to the medication or drugs that are used to treat depression and other psychological and mental disorders. And CBT, a form of psychotherapy that aims to reduce symptoms of various mental health conditions, including depression. And the last one was electroconvulsive therapy. It's also a form of psychiatric treatment that can be used for depression. Okay, the next item here, talking about the common signs and symptoms of depression that people manifest. Like I'll list them down here: low moods, not having pleasure in doing things that people used to enjoy, feeling worthless, you feel inappropriate guilt, poor concentration and memory, withdrawals from social situations, you lack sexual drive, and sometimes people get irritable because of depression. And then when we come down here for the purpose of screening, In primary care, we really serve as the main entry point for healthcare providers for patients to get access to healthcare. So most of the time, it's easier to access a primary care doctor than you can access a specialist. And in general, patients don't know the difference until they have a healthcare experience. If you are a doctor, you are everything. They may not know what's your specialty and all that. And the main entry point tend to be a primary care doctor. So it's crucial for us as primary care doctors or providers to be able to know how to screen for depression or other disorders so we can treat or refer accordingly. And the other thing, as I mentioned in the previous disease, those signs and symptoms of depression mimic so many other diseases. So as a result of that, we want to make sure there's no other cause of your symptoms before we say this is depression. For instance, you can have fatigue for other reasons like low vitamin B12 or thyroid disease. You can have low sexual drive because of lack of hormones or other stressors or things like that. You can fail to enjoy your job because you are fatigued and it's putting too much strain on you. So that's why depression is very common to other diseases. But before you mention you have depression, you have to have a good screening tool. And the PHQ-9 is one of the most reliable way of screening for depression. When you use the scale, which is on the next slide, it has the question that you ask the patient, and they'll give an answer ranging from 0 to 3. And so 0 being not at all, and then 3 being nearly every day. You're really asking the patient how often they are experiencing these various items on the list, and then you're giving them a number. And the higher the number, the more the chances of depression being coexisting. And the truth is, sometimes a lot of people don't know they are depressed. They know I'm feeling bad, but they don't know what it is. And so this tool can after you rule out medical disorders and you do a tool like this, it can help you understand, you know what, this is where your problem is. So after we do the screening with this 9 questions, you get a total. So if you have a 0 to 4, you have no depression. 5 to 9, you have minimal depression. 10 to 14, moderate. 15 to 19, severe. Moderate severe. And 20 to 27, very severe. So in this question, if you really look at the question on the screen, a good amount of us have at least minimal depression. I don't know anybody that's 0 to 4, like little interest or pleasure in doing things. But if you use them all together, it can give you a complete idea of who really you should worry about and who should be normal. Like a 0 to 4, normal, but then minimal depression is also something you can deal with, meaning it doesn't affect your quality of life. But the minute you get to moderate, you definitely need to do some action to mitigate your symptoms so you can have a better function of life. But needless to say, even those with minimal depression need some intervention so you don't escalate to severe. And the earlier the intervention, the better. And that's the scale we talk about. Now, the treatments for depression, as I mentioned earlier, we have 3 common ones: psychotherapy, pharmacotherapeutic, and electroconvulsive therapy. So I'm not going to bombard you too much with the names of medication. I'm sure we had our psychotherapy provider, Dr. I think her name is Perpetua Nyangao, talk about psychotherapy medications. So I'm also going on the steps of what to expect when you happen to be diagnosed with depression. So when you do treatment with psychotherapy, we focus more on like counseling. So if you suspect having depression in your people you care for or your patients, definitely encourage them to seek counseling. through their other mental health counselors, psychologists, and even psychiatrists. And psychotherapy can also be done using cognitive behavior therapy, CBT, which is the most common one used. Myself, as a primary care doctor, I focus most on very basic counseling and pharmacotherapeutics. And then if somebody needs more than that, they either I get them a referral to a psychiatry or a mental health counselor. Then they can delve into deeper into other treatment therapies that are appropriate. So for the most part, as a primary care provider, depending on your level of confidence, you can treat certain levels of depression, but once you figure this is not in your in your skill set, then let's make use of our mental health counselors. And like any other disease, a multidisciplinary approach is always best when you're caring for complicated situations. And then when you go to medication, we reserve medication for people who have moderate to severe depression. Those ones you need both psychotherapy and medication as a combination as opposed to one. Minimal or moderate depression can easily be managed by psychotherapy alone, but study after study points to the more you get more depressive symptoms, the higher the chance you're going to need multiple methods of treatment. And then mild depression that has been present for a long time and psychotherapy alone is not enough, you need to do medication as a choice. And then also can also be used as a second treatment for those who are not responsive to other therapies. But as a first line treatment for moderate or severe depression is key, because when you are severely depressed, you may not have enough in you to really pay attention to attend to psychotherapy. So that's why the earlier you start intervention, the less chances of having complications. And then the electroconvulsive therapy, this is is used, but is reserved for severe cases. But just know that it's an option. And if you are in the primary care setting, it's always nice to prepare these clients of what to expect when you are referring them out, because most of the time, as a primary care provider, you are with them more, you may have a stronger relationship with them to help them, encourage them to know, okay, this is what to expect. So when they hear the terms out there, they're not caught off guard. They kind of have an idea, but then they get deeper details of what each treatment entails when they get the appropriate provider that's treating them. And then, my main take-home message for today's presentation is for us to make sure we establish a good relationship with a primary care provider and normalize seeking medical care. It's unfortunate that a lot of people still don't believe in going to a doctor, even though they may have the resources. And if you don't go to the doctor, whether you are a man or female, you're going to miss out on early treatments. And when it comes to depression, you can suffer depression for years, get irritable at home, get angry, have low sex drive, have all these symptoms. But because you've never sought help, you don't know what's going on and you're not living at your best potential because you did not seek help. And I know men's focus is we tend to be tough and we want to provide, but we cannot provide if you don't get your health together because it affects your quality of life and your productivity. And then as a provider, we also want to normalize screening because a lot of people with depression, if you look at them at face value, unless you really dig deeper, it may not be something that comes on your mind that I should help them get help for other things. Like for instance, you come to me, you ask me, okay, I am here for physical and I don't have any complaint. So as a health provider, it's a good idea and it's actually a recommended tool for me to offer you this tool to complete. And when you complete this screening questionnaire, PHQ9 that I talked about, I am looking for your numbers, and hopefully that numbers will help me provoke some questions that can help me know there is something beyond just your regular checkup. And doing that can help me pick up a problem that the patient may not know they have themselves either, and that can prompt therapy and treatment which can help enhance the quality of life. But unfortunately, we just don't normalize it. And when it comes to men, we want to be aggressive because a lot of the time they don't seek help. And if you have a patient who's a female and you know they have a male partner, try to encourage them. Oh, I haven't seen your son or your husband. When is he coming for his checkup? Because sometimes that can also help them. Okay, my doctor wants my son or my husband to come get checked up. Let me go try to encourage them to come. And most importantly, for people with depression, sometimes they can feel a low quality of life or feeling different because it's not normalized. Nobody wants to be labeled that they have a psychiatric disorder. We want to encourage and be supportive. And as I mentioned earlier, untreated depression has serious consequences to individuals, family, and the entire community. And that concludes my presentation. I'm open for any question or discussion at this point.
So you have to.
Yeah, very good. We
Right.
thank you. We want Mr. Come now, Reverend. I have to get used. Tell us about that. Reverend Anthony Come now, Mr. Kevin, can you help us here? Thank you so much. I was actually I was going to almost take a picture, then I remembered it's going to be, it's being live taped. At this point, this is very helpful, and I will lean on it and review, even for my own sake. I like the 5 questionnaires. Is it questions? The ones that the primary care physician asked, but he didn't tell us it was mental health.
It's
So,
called
Nikki, I want it to be mental health so people know. Yeah?
It's PHQ9. It's a questionnaire that is a self-administered questionnaire. And it helps you identify problems that might not exist. Just like when you come to me and I draw blood work to check for your cholesterol and you are not sick, it kind of helps you identify problems that might be there before you see symptoms. And I kind of like it and I use it quite frequently, at least every year when I do annual and also for new patients. And the other thing to note is that you can ask the patient these questions, but unfortunately, some people will give you answers to please you. So it's better if you let them answer in their own space as opposed to you asking them those 9 questions.
All right. Anyone with a burning question before I stop live in the next 5 minutes? Kevin, do you have a comment, a question?
No, I just want to say thank you so much, Dr. Moharty. That was so well explained, and it ties into what I had just touched on earlier. That a lot of times when men, especially men, are given normally a lot of providers will give you like a clipboard, and step away for you to complete. Just be honest on those questions. Just don't feel like you're rushing through just to get your appointment done. And it's also really, really good just to have a relationship with your provider. A lot of us, we enjoy, especially when you come in their family visit. Either you see husband and wife, or you see husband first, and then the wife comes right after. And the way we are moving in especially if you're in the United States. In terms of health, it's really good to have a good relationship with your provider. Don't feel like you're bugging them when you have to text or call them. I believe Dr. Moharty would advocate for this. If you don't feel well, call them. That their relationship goes just beyond that hour or 45-minute session that you have in a clinic. They give you their number, get confident to call. Hey, I don't feel right. You started me on this medication. Don't wait until 2 weeks down the line. It's good you say so they can advise you early, mitigate any admission to the hospital. I know a lot of us don't want to be admitted or go to the hospital, but those comments, those concerns you have, helps to build that trust, to have a good relationship. So you're not just looking at, hey, I came in, you got my information, your number, and you're gone. Follow up is really, really big in especially anything that you get started. If they give you a 2-week follow up, let's own up into it. Let's be a participant patient. You don't have to come
One.
when it's crisis. Participate in your care. Be owned into it. A lot of us have insurance, and I'll touch a little bit on what Lorraine said. If you cannot afford your regular medication, let your provider know, because a lot of times in the time of prescription, you can look into different cost aspects that can be covered. And some of us that do have commercial insurance, sometimes that commercial insurance has a separate pharmacy that gets you discounted, so you're not falling off your prescriptions. If your medication is ending and you're in a cycle every 30 days or 60 days, you get it. Work with your provider. Let us Part of removing the stigma is that communication,
Exactly.
and we want to build that trust, and we can't build it in a 1 hour session. It's, hey, I don't feel well, I woke up feeling this way, and you want to, that communications help to build. And down the line, if you need any testing, any follow-up, if they call you for lab results and you can't answer because you're at work, return the call back. Simple gestures. Hey, and this is how you build it, and you get that care. And sometimes you don't even have to be there. I believe Dr. Moharty, maybe in his practice, he provides a follow-up virtual visit
Oh
if
yeah.
that's available. Yeah, these are different things. So we don't have the traditional mindset like, hey, I have to come sit in the lobby for a 30-minute waiting, or I'm rushing for work. I cannot. All these excuses, we need to kind of take them away and work with your provider. Communication is really, really big, and also your involvement. Own up for these processes. Um, Thank you. Thank you, Dr. Moharty. I'll post it. I'm just passionate about this, and it's really.
Okay, one more last comment. We just have to make sure, let the patients know. I try to do this myself. You can't fix everything in one day. Healthcare is complicated. And the more you get to interact, if you're not sickly and you do annuals, the more you keep the same person, the more they're going to figure some things off you because they will pick what is your patterns. And when something is off, it's very easy to figure out and they can help you. And then on the other hand, too, if you are one of those people that come every 3 months or every so many months, you give less stories if you establish a relationship with a provider. And this will be true if you have a psychiatric problem as well and you're seeing a counselor or a psychiatrist, because you establish the pattern, things gets easier for both of you. So my 30-minute visit to end up being a 10 because I don't have to ask you too many repeat questions, because I know you from your chat. And sometimes after you know somebody for so long, the minute I see Kevin, I can know Kevin. I don't have to ask too many questions. I remember what you're on. I know what you cannot take. So let's just encourage frequent establishing a pattern with somebody regular. When you relocate, find one and try to establish a pattern. Myself, I've been seeing the same eye doctor for almost 20 years since I've been in Baltimore, because I found somebody that I feel a belonging, that is compassionate to what she does. You see, so when I go there, I'm in and out. And we can do the same thing with the regular medical problem and mental disorder providers as well. Thank you.
All right, everybody. Thank you so much, Dr. Mohadi. Thank you, Kevin. Rev, if nobody has a question, you want to close, then I can stop the YouTube.
Yes, because I have a question, but it needs to be off
Okay.
the record.
All
For
right.
now, thank you so much, Mr. Kevin, Reverend Anthony. Wow. And our Dr. Gerald Mohati. We got your name right this time.
Yeah.
Thank you so much for sharing from your heart again. And thank you, everyone who is listening. And we are catching your comments on the chat. So this concludes our time together on YouTube. We want to speak well concerning the issues we have mentioned. Just take away for yourself what the notes you have taken. However, maybe in a few weeks or days, we will be able to share this recording with you in our favorite WhatsApp, Facebook, and other platforms. When you get our information, can you just like us, listen, and subscribe? That's how we are going to build. I want to say a special thank you on record for Dr. Gerald has been with us in our conferences, not one time, not two times, 3 times. Is it 4? I lost count. But I have also, yes, I have also had him in another forum called Marriage Dynamics Forum. That forum was also held in Denton, in Texas. I think it's 2011. So when you said you went to school there, I was like, yes, I know the place.
Yeah.
God bless you. So thank you so much. We are getting off the YouTube and